In room 3 today, we have a session entitled Family Caring Conversation Intervention in Chronic Illness, Preliminary Implementation Testing, and it describes the preliminary implementation of a family-focused intervention, the Family Caring Conversation, to support family members within the context of chronic illness prior to a larger pilot test. The questions and hypotheses include, what are family members' experiences of the family caring conversation to support managing ongoing family life in crisis? And family life in chronic illness. And 2, what intervention or measurement approaches require revision prior to a larger pilot testing of the family caring conversation? Our speaker today is Dr. Sonia Myers, and she is a nursing faculty in our nursing department here at Winona State.
Well, thank you so much for being with me today in sharing this poster presentation. My co-authors are at Winona State University, Dr. Norma Krumwiede and Dr. Sandra Eggenberger. And our work has traversed 10 years of work together. I was formerly a faculty member there and continue to work with that research group. We are supported for this work by the Winona State Foundation as well as the Glenn Taylor Institute for Family and Society Nursing. So it seems as if my research trajectories are joining together, and I have become very, very familiar with chronic illness over time. So I'll share that a little bit with you today. And this particular study is a small pilot study, small testing study of an intervention that's a specific chronic illness intervention. The data are that chronic illnesses or conditions are irreversible diseases, and they require supportive care and self-care maintenance of function and prevention of further disability. Things like heart disease, stroke, cancer, chronic respiratory diseases, diabetes, closed head injury, developmental delay, and mental illness are most common among chronic illnesses or chronic conditions. I will probably say CI or CC today. And then approximately 45% of all Americans suffer from one or more of these, and between 26 and 50% of families are affected as well. Family members with CI or CC and their family caregivers are at risk for anxiety, depression, psychosocial alterations, and physical illnesses. Family member responses within the CI or CC influence the psychological and physical health of the caregiver and the care receiver simultaneously. So both and together. Therefore, it's necessary to develop nursing interventions, or perhaps we would say interprofessional interventions, to support family members managing ongoing family life in the context of chronic illness. So our purpose, and I'll tell you a little bit more about the trajectory of our previous work, but our purpose in this study is really to describe preliminary implementation. I hope you can see this okay. I'll just make it a little bit larger. To describe preliminary implementation of a family-focused intervention, the family caring conversation, which is a specific type of a conversation that's structured to support family members within the context of CI or CC, prior to a larger pilot test. Our research questions then specifically are, what are family member experiences of a family-focused intervention to support family members managing these chronic conditions or chronic illnesses? And what intervention or measurement approaches would need to be revised prior to a larger pilot study? In 2011, we developed this model of the context of chronic illness. We call it the reintegration within families in the context of chronic illness model. We note that families who are managing a chronic illness recognize their own individual and family vulnerability in the context of chronic illness that is imbued with family uncertainty. They develop caring strategies of things like planning, monitoring, and protecting. The family then engages more fully with the chronic illness by connecting with each other, pondering the future, relating together, and struggling. But all of this happens as the family naturally is evolving as a developmental unit. So we chose for our study a methodological approach, which just simply means we're looking at the numbers and how that happened, but also some of the narrative experiences of families. We did a convenient sample of families managing CIRCC, and our measures were the Family Integration Experience Scale Chronic Illness, which we have just had published in this spring in the Journal of Family Nursing. We also used the classic Mischel Uncertainty of Illness scale, as well as some researcher-developed measures to track families' background, their satisfaction with the conversation. So we asked them after the intervention, how was it? And we have a specific tool that we use for that. And then we had a fidelity measure. So we have the family caring conversation basically with check boxes to make certain that we attended to the things that we needed to attend to so that we had fidelity of the intervention. And then we had researcher field notes. I'm going to tell you a little bit about the family caring conversation without making you ill, sorry. That the family caring conversation is one that starts out with an introduction. We collect a genogram or ecomap, or a way to look at the family structure. We ask them what their shared experience of the illness is. We talk about specific family caregiving strategies that they might have developed, and then we look at all of the other content of the intervention: pondering, change, burden, struggling, vulnerability, financial concerns, family growth, and family relationships. These are all phenomena that have developed over these last 10 years of our work together. Families have told us that they're dealing with those kinds of things, and that those phenomena are also the elements of the measure that we use. So we're doing the intervention using the information that families have told us, but then we're also measuring it. So here's an example of a question, an area that we might talk about related to family burden. The family, we ask the family and we interview the family together, at least two people in the family, and the person who is struggling with a chronic illness the most, the patient, we sometimes would say, but sometimes it's actually the caregiver. But we ask the whole family, managing a chronic illness often creates demands and stresses on the family. What would you describe as your greatest burden? And how would you describe your family's resources? Some families have found X to be helpful. Is it all right if I share some resources with you? And that's our opportunity to do some teaching within the intervention. So the intervention is a conversation and teaching. The results that we have for question 1, we interviewed 7 family members within 3 families managing 3 different types of illnesses. 1 family member was unable to complete the uncertainty scale due to physical disability, but was able to complete the other scales because they were verbally interpreted. All other participants completed all measures, and 100% of the participants were 100% satisfied at a level of 10 with our intervention, with the conversation, with the family caring conversations. They described it as being very comfortable and giving them an opportunity to opportunity to talk about things that they haven't really talked through, and that the flow was very smooth and logical and makes us think. And question 2, the tracking measures were multiple for the different measures that we had. So that became burdensome for the interventions and also the participants. The Mischel uncertainty scale we determined was a bit unsuitable for directing a pre and post intervention, because we're trying to look at effect pre to post. And so we will still continue to use that, but not measure pre and post, because that adds quite a bit of burden to the care givers and the patients. And then a measure of caregiver strain is being added for the larger pilot study, because we saw that we were not capturing that particular element in their lives, and we wanted to be able to do that. So the validated, reliable, nationally known measure. And so we will add that. So our conclusions are that family members are very satisfied with the family caring conversation as constructed, and it needs no revision. But the use of a collated measure booklet might be more helpful instead of separate measures, and revision of the study measures will strengthen the larger study. So, and then I think if you have, I think this reference label on the bottom, it's QR code, but I'm not sure that you can read it. But if you would like the references for this particular poster, I would be happy to send them to you. So I will stop sharing and see if you have any questions.